think it's always worth running past clinicians any medical devices or pen devices, because we, as a diabetes nurse specialist, we are around patients all the time, showing them pen devices, seeing how they plunge them, what their dexterity is like, so we can give feedback before a product is launched.
To reach out more, so I think they do a lot of work with GPs and CCGs, but actually myself as a dietitian, we can influence CCGs, GPs and patients as well. So reach out more to other health professionals that are involved in diabetes care as well, because actually someone with diabetes will have input from so many different professionals, not just GPs and doctors. So by reaching out to different professionals, it's obviously going to benefit them in terms of, if we know more about their products, then we'll be able to recommend their products. And it's also going to be beneficial for the patients as well, because they'll be getting the benefit of using the software or the devices that you provide.
Where people can actually share information and you know what's happening with your patient. For example, if you've got the NHS is quite a big organization, and it shares information between different people. So, for example, if you've got an app where everybody can actually share information, so that by the time they come to A&E or critical care, then you actually have an idea what their blood glucose levels have been like, what medication they are on. So if you've got something like that they can actually, then you can sort of like look at it in real terms, more or less. So you've got that information. I don't know if that would be something that manufacturers could do, or whether it's something that obviously the government or NHS could do. But I think something like that for me would be easier, so that at least you've got a sort of like a real, more holistic look at things.
I would think when companies bring their product in, the message should be very simple, saying what sort of extra benefits they get from using a particular device. For example, I saw a device today which is very small, and I have to say I wasn't using it before. I would think that kind of small device will be good for someone who moves around, who is dynamic, and who's working in the field or something like that, because they can keep it in the pocket, and they wouldn't even notice. It's a big thing for them to carry, really.
The time we have with patients are reduced day in and day out, and we don't have so much time now to work with so complex devices. So what I would say is, if devices can be made much easier to use for patients, and also for us, the healthcare professionals, for us to be able to educate them, not taking so long, but just a little time to educate patients to understand, and also if there are instructions in some of their device packs, to make it easier to understand for our patients.
If you're going to give medical devices, look at the information. What information? And I think the font on informations are so tiny. A lot of patients can't see. They find it hard to read. So I think it needs to be very pictorial. I think it needs to be, the font needs to be bigger, and it needs to be really understandable. What we read, we can understand. We're healthcare professionals, but actually, what is it the patient can read? What is it they can see? Can they see the blood glucose monitors? Can they see the readings on there? Can they understand them? Can they make sense of them? Do they actually know, if they're having a hypo, what to do in a hypo? So if they have a blood sugar of maybe 3.5 and they feel absolutely fine, would they know what to do? So I think the manufacturer companies really need to hone in what the patients want rather than what the healthcare professionals want.